Although dietary supplements are generally regarded as a way to manage one's health, they are regulated by the FDA as foods, not drugs. However, they are subject to very specific regulations that differ from those for other food categories or medications. With RFK Jr. now at the helm of Health and Human Services, dietary supplements have come to the forefront of the news, and TAG has stayed on course with that, with the hiring of dietary supplement expert Tony Lucas. I'm Lisa Lupo, your host of TAG Talks Food Safety, and today I'm talking with Tony about supplements, the regulations to which they are subject, and what dietary supplement manufacturers don't know that they don't know. Welcome, Tony.
Thanks, Lisa. How are you doing today?
I am doing just great and glad to have you.
Thanks.
So, to get us started, can you provide a brief overview of your experience working with dietary supplements?
Sure. So I've spent the last decade and a half working in multiple areas of dietary supplements and the food and beverage industries. Most of my time has been spent between regulatory affairs and between QA and QC at various companies, helping to build their quality and regulatory programs to keep all those products safe for consumers and to make sure the companies are in compliance with all the FDA, USDA, and other various regulatory bodies around the world. Many of the ingredients and finished products I was working with often contained dietary ingredients which were also novel to this part of the world and specifically to the US. So I had to spend a lot of time working with suppliers and dietary supplement industry groups, third-party laboratories, and various other regulators to try to find the best way to legally produce whether it be the labels, the finished products, helping them set up their testing protocols, as well as marketing materials to get the products on the market. Dietary supplements are often regulated in very differently in various parts of the world, so labeling is extremely important to those selling across various markets.
Okay. So, with all that and from your experience, how familiar are dietary supplement businesses with the FDA regulations?
To be honest, most of the large companies out there that you're seeing at the stores all know they have to be in compliance with FDA manufacturing requirements, very similar to the food industry. This doesn't mean that they're all perfect, very similar to many of the food companies we work with. Um, there are areas of improvement for all of them, but all of them do understand that they have to be in compliance with the FDA and they have
Mhm.
to be in compliance with any local regulatory bodies. Many startups and smaller companies, including companies who import products from other countries, they often struggle with manufacturing requirements and documentation practices similar to small food companies that are just starting up. Those things are not easy to understand when you come from, let's say, a marketing background and you want to bring out a new product.
Mhm.
Just like, but every company does need to be in compliance with these regulations. Specifically in the US, the regulations are generally written by the FDA and enforced by the FDA, the USDA, and even the Federal Trade Commission, the FTC. Just like the food products you consume, dietary supplements can be just as dangerous for consumers produced without safe practices. So it's extremely important to be thorough with supplier assessments and manufacturing processes.
Okay.
In addition to that, these products are also produced. All the products produced under these regulations are produced by their same required safety practices that the food industry requires, including finished testing and labeling.
Okay. And when you talk about labeling, FDA allows three types of claims for supplement labels: health claims, nutrient content claims, and structure function claims, correct? Can you tell us about these a little bit?
Yeah, health claims are probably the most well-known. Those are going to be claims that relate an ingredient or a dietary supplement directly to a health condition. These are claims that have been pre-approved by the FDA. An example of one would be adequate calcium and vitamin D as a part of a healthful diet, along with physical activity, may reduce the risk of osteoporosis later in life.
Okay.
Now, just saying those words, obviously it's a pre-approved statement, but there are additional things that can also indicate that you're making those claims, such as pictures or symbols. Some such as a picture of a heart would be indicating that the product itself is good for your heart. If you want to make that claim, and when I say make that claim, it means use that symbol, you have to
Right.
be following the FDA's guidelines or have an ingredient that's already been pre-approved for that statement. Next, we have our nutrient content claims, and those are going to be revolving around the nutrients that appear on your supplement fact panel on the label. Common nutrient content claims are excellent source, good source,
Mm.
sugar-free, fat-free, low in sugar, and even the new one that's highly being regulated is the word healthy. Bringing up
Right.
the DV, the daily value percentages per serving of any specific nutrient is a type of nutrient content claim. These claims have to be verified, tested, and accurate throughout the entire shelf life of your dietary supplement, the same way that any food product does. Finally, and probably the most difficult to understand and comply with, are what's called structure function claims. And these are when a nutrient or an ingredient directly affects the normal structure or function of the human body, a specific organ, or a specific part of the body. Examples of these include that you've probably heard are omega-3 fatty acids help
Mhm.
support heart health, or probiotics support digestive health, and blank supports a healthy immune system. All of these statements have to be one, they have to be truthful and not misleading. They have to have substantiation to back
Mm.
these claims up. That means you have to have studies, you have to have research, or you have to have some sort of formal study in general that links this product to that positive effect. They also, and everybody's probably seen this on your on your vitamins, they have to be accompanied by a statement that says this statement has not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease. That statement specifically indicates the difference between a dietary supplement and a pharmaceutical product. Those are two very
Okay.
different products. Common issues that a lot of companies make are overlapping these structure function claims with what the FDA would call a disease claim. An example
Mm.
of this would be stating your product reduces the risk of heart disease. Heart disease, by stating heart disease, that instantly makes it a disease claim, and that would then put you in pharmaceutical territory. A way to get a more accurate structure function claim will be to say an acceptable one would be something like supports healthy heart function. It's a little vague, but that is what will be acceptable for the FDA for a structure function claim.
Okay. It's a bit complex there, isn't
It is
it?
extremely complex. And not only that, um, structure function claims are highly viewed by the FTC and the FDA. So it does take a lot of revisions. It takes a lot of confidence in your substantiation to do those.
Okay. So with, having those claims very highly regulated, what processes or approvals are required of a manufacturer before they make such claims or when they're introducing a new dietary supplement?
Yeah, to make a structure function claim, such as what we just talked about, you actually
Hmm.
have to submit your structure function claim, and most of the time that includes the label that it's appearing on to the FDA for them to send you a letter of no object or just so they have it in their records. It has to be done within 30 days of when you start selling your product. Also, you have to submit any substantiation or scientific evidence to prove that that structure function claim is adequate if they do ask for it.
Okay.
Now, submitting a new or bringing in a brand new ingredient that you will want to put into the product is a whole different category of submissions, and that's going to be called an NDI submission, or NDIN. And that actually requires a lot more of a robust submission to the FDA, where you have to actually, it takes up to 75 days before introducing the ingredient to the marketplace is when you have to submit your information. Now, these are a lot more complicated, and this is required of any ingredient that has not been on or was not seen in the marketplace as a dietary ingredient before 1994, which is when the very first dietary supplement regulations, known as DSHEA in our industry, was introduced. Now, in addition to the NDI submission, you also have to submit in this one, it is required to submit all scientific and safety studies that have confirmed that your product is safe. And you also have to submit it in a dosage form. So you have to say how much of it's going to be in there, and you have to say how often it's going to be given to a patient, or I'm sorry, a customer, whomever is going to be purchasing it, if they're following the proper dosage on your label. So it is a lot more challenging. The level at to which you have to prove it to the FDA is a bit higher, and so that's something that we have gone through that we definitely would be happy to help out any of our customers with, or any of our clients. It is an extremely difficult process, but it is worth it if you do have a new ingredient that's going to change the industry.
What if you're just bringing a new product to market that's like not a new ingredient and you don't have any kind of major structure function claim? Then does FDA have to approve that too?
So if you do make the structure function claim, the FDA does have to get notice of it regardless. But if it is an established ingredient on the market, you
Hmm.
do not have to go through the NDI process unless you're changing the dosage. In that case, let's say an ingredient wants to be, or in the NDI, original NDI, it was approved for use at 20 milligrams and you want to use it at 40 milligrams. In that case, you would have to go through a resubmission, or dosing resubmission to prove the safety before you can get it on the market at that level. So there are requirements that if you want to change the scope from what was originally improved, you kind of have to do your studies, redo a study and do a resubmission. And there are a number of products on the market where the original NDI was much lower, and you can see a follow-up of close to 10 or 20 resubmissions from other companies trying to jump on board with higher dosages. So it is very common.
So with all those types of things, though, if you're putting just a finished dietary supplement on the market, does FDA pre-approve that as well?
The FDA does not need to give pre-market approval for a generic dietary supplement that does not have an NDI ingredient in it.
Okay.
That is why I think a lot of consumers out there believe that the FDA does not regulate dietary supplements. It's because there's no pre-market approval, very similar to what they do, which is required for pharmaceutical products, but that is not required for a dietary supplement finished product.
Okay. So again, lots of complexity here.
Very much.
What do you find to be the most misunderstood aspect of regulation for dietary supplements?
The biggest one that I hear out there, and often when I went to work in the dietary supplement industry, friends and family often fell into the rabbit hole of believing that the dietary supplement industry is unregulated and often fraudulent. You see news stories all the time of, when ingredients come into the country, they test them and they're fraudulent, whether it be, they're trying to put in a specific ingredient and it turns out to be something else.
Hmm.
Is extremely, very, I would say, inaccurate. The dietary
Okay.
supplement industry is extremely regulated when it comes to the safety and manufacturing of finished products, as well as claims. All of those are being constantly watched and regulated, and if you do go to the FDA website for warning letters, or the FTC, the Federal Trade Commission, website for warning letters, they are constantly sending out letters to companies who do cross the boundaries of what is legally allowed and what is not.
Okay.
Large companies, large retailers, I should say, um, such as Costco, Amazon, and Target, they have very strict requirements for all of their dietary supplementing products that come in the door, having required GFSI audits, which is GFSI is the same structure of auditing required for the entire food industry. All of them require a certificate of analysis, which is basically third-party testing that requires identity, purity, potency, as well as guaranteeing all of the nutrition facts on the actual product, as well as good manufacturing process certificates, which
Oh,
even more strict than a lot of the food products that they're selling. Another topic that I think a common misconception with a lot of consumers of dietary supplements is that they're there to replace the foods you're eating.
all
Dietary
right.
supplements are designed to be supplemental for your daily food intake. They're not designed to replace it. They're there to help close the nutritional gaps that you may not have gotten today. Let's say you had a small breakfast or lunch and you didn't get all of the vegetables or fruits that you're supposed to eat for the day. They can help supplement that last 10 to 20% that you may not have gotten with your food. Um, in addition to that, dietary supplements are there to, some of them also provide nutrition that is needed in excess for certain moments in your life. An
Oh,
example of that would be during pregnancy. Women are often encouraged by their physicians to get an extra dose of folate, folic acid in their diet because it does help with development of the baby. And that is something that dietary supplement companies can help provide because getting an extremely high dose of folate is not always easy because there's only so many leafy greens you can eat
mm,
or food in the day. Everyone's busy. So that
okay.
and another example would be getting extra calcium or phosphorus when you're healing from a broken bone. Doctors
Mm,
often suggest adding additional sources in, whether it be with your food or dietary supplement to help heal those bones a little bit quicker.
okay. So a lot of different things involved. I've probably said it 3 or 4 times. It's very complex. So
Very
given all
complex.
that, what does TAG do? How does TAG assist dietary supplement manufacturers?
Yeah, TAG is here to help companies file for their FDA registration. Again, all dietary supplement companies have to register with the FDA or whatever regulatory body you live in, whether that be CFIA or somewhere else in the world. We can help you out with new dietary ingredient notifications and actually submitting. If you do want to bring one of these novel ingredients to our country, it would be great to help you submit that and allow you to change the dietary supplement industry with your new ingredient. We can help you understand and comply labeling requirements. Again, labeling requirements change country to country, and especially within the US, the labeling requirements are extremely complex. Another one is to help adhere to nomenclature for certain ingredients. Just putting the correct name of the ingredient on the finished product is difficult because they often come in with different names and you
Hmm.
have to label it a different way. We can also help you safely use structure function claims, make nutrition claims, and evaluate any of the health claims that you may want to make about your product.
Okay.
Another big one is to help you review your marketing and social media claims. I can't tell you how many companies have gotten warning letters about their websites, making comments on whether it be LinkedIn or any of the retailers' websites, such as an Amazon review. We
Hmm.
can help you liaise with government officials or even help you get connected to some of the dietary supplement industry groups. There's a number of industry groups that are out there to help companies who want to work in the dietary supplement space. And they're extremely helpful when you're trying to get new ideas or even just socialize with other companies. And then one of the most challenging parts of any company is the final thing that I would suggest that we help you with is if you do, unfortunately, get one of these warning letters or notices from the FDA, the FTC, Health Canada, etc., we can help you respond to those regulatory notifications and help you get back on the correct track to make sure that you move past this and you never have those issues again.
Thank you, Tony. There's we've covered a lot of areas related to dietary supplements and hit on a lot of different points. with all this, what would be, say the 2 or 3 takeaways that you would want our participants to be sure to remember?
Sure. First, I would say, please remember you have to register with the FDA and
Okay.
comply with all manufacturing regulations. The dietary supplement industry is highly regulated and you need to follow the rules. Two, I would say dietary supplements, again, to remember this, dietary supplements are not going to cure diseases or replace all of your daily meals. Please don't try to market them that way. You can create, of course, meal replacements, but that is not to be an entire day of food. And finally, be very careful with your claims. This includes your labels, your website, and even, and I would say especially, your social media accounts. Even interacting with a customer's testimonial that involves a disease claim is viewed by the FTC as being complicit with that claim. If someone claims their disease was cured by your product and you give it a like, that is seen as you being complicit with that and saying, yep, that's true. And so that gets a lot of companies into trouble. And so those are the sorts of things that I would recommend taking an extra look at and being very careful on social media.
Okay. Thank you once again, Tony. I feel like we could do a whole nother session on this, and maybe we will. Um, but I would like to also thank our listeners for listening in. We hope that we have given you some new insights on the often complex world of dietary supplements. And as always, to stay informed on all things food safety and public health and ensure you don't miss any episodes of Tag Talks, be sure to like, follow, or subscribe on YouTube, Spotify, Apple Podcast, or whatever is your favorite platform. Thank you.